The second thing is, what are the side effects of having gallstones? You see, why to wait for any side effects to happen? Pain, infection, pancreatitis, malignancy, a huge list is given all over the internet. You can find, you can see in the books, you can discuss. But my point is, why to wait and why to expose yourself to this kind of complications? My whole idea of telling you this is, it is a disease of the gallstone, and when the stone has formed, then don't wait for it to increase by 1 millimeter or 2 millimeter, or it has no value, because the gallbladder is diseased and it needs to be operated, and it needs to be operated in a very planned and controlled situation where we can control your blood sugar, your hypertension, where your heart medicines, where your checkup can be done, and the risks of the surgery and anesthesia can be eliminated as far as practicable, rather than going into an emergency situation where these things won't be possible and you will be fighting the complications of gallstones. So yes, the treatment of the condition is definitely surgery. Is there any other alternative to surgery? No, because in any kind of medical practice, be it homeopathy, be it Ayurveda, be it anything, if anybody has this, so far no such kind of medicine is available, but if somebody promises to do so, he can just take out the stone. But the problem is in the gallbladder, so taking out the stone will not solve your problem. The gallbladder has to be removed, and it has to be removed by surgery. So yes, surgery is the only form of treatment in gallstones. If you have been diagnosed with gallstone, if you are suffering, then you must plan it and get it done, and then live a very productive, healthy and complication free, tension free life after this surgery. There is no such restriction that you cannot eat this, you cannot eat that. What we recommend is, you should not keep your stomach very empty for a very long time, because the acid, they will secrete, the stomach will secrete acid in any which way, and your system will not have enough bile to neutralize that, because the gallbladder is not there. So small frequent meals are recommended after gallbladder surgery. And what you need to avoid, if you are a diabetic, you need to avoid things which you should avoid in diabetes. If you are a heart patient, you should avoid things which you are already avoiding for your heart condition. So there is no specific restriction. Only what we recommend is, one, don't keep your stomach empty for a whole lot of time. Take small frequent meals. And second, don't take too much of fatty food at a time. That will also cause some temporary, it might cause pain, it might cause discomfort. So these are the only two small things. Immediate post-operative period, whether you have undergone an open surgery or a laparoscopic surgery, yes, office, joining back to office, traveling, these things are not restricted. But yes, you are not supposed to lift anything which is very heavy, or push anything which is very heavy, or you are not supposed to do anything which is very strenuous for your body for the first 6 weeks after surgery. Not because of the complication which might happen related to the surgery, but you might form a hernia from where the surgery was done, whether it is open or whether it is laparoscopic. So strain on the abdomen you should avoid for the first 6 weeks. After that, you are free to do whatever you want, and there is no specific restriction. In Delhi, I have encountered this question time and again, whether I can have tomatoes, whether I can have lemon, whether I can have curd. Has curd caused damage to anybody in the whole world in ages? No. So you are not going to restrict yourself to all this. Tomatoes have a relation, guava and things like that, they have a relation with forming stones in the kidney, not in the gallbladder, and definitely not after surgery. So these kind of restrictions are not there. You are going to have your normal food, whichever your family is having every day. You are going to join back work. You are fit to travel. Only thing is, for the first 6 weeks, you are not going to lift anything heavy, and you are not going to do anything which is strenuous for the body.